Yeah, as I was getting ready to come and meet you, I had to realize it's been 40 years since I met Milton. And what I think is important to for everyone listening to understand the filter in which I receive the work is to give a little bit of my history, because I was reflecting on how I was pretty much primed to understand what this work was when I met him. And what I mean by that is I grew up in the Bay Area, California, which meant going surfing in the afternoon. That's just what we did. And it was the early 70s, where in the educational system, they were really doing the accelerated learning for those students that had the higher capacities. And I was on that track, and I had an older brother, 8 years older, who introduced me to going to Tai Chi class once a week with a Chinese instructor at the local college. There were these exposures to other ways of thinking and understanding life. And there was always included body movement with some kind of cognition or receptivity to how energy flowed. And it wasn't something that felt too, it was just in the soup of the Bay Area. And it was just around me. And one of the things that I did is I got a part-time job when I was 15 and saved my money. So on this accelerated track, graduating a year early, 3 days later, I moved to Hawaii and was able to support myself there and put myself through college and established a local lifestyle in that I was in an ancient hula school of dance, and we performed. And what's important about that is that the first 2 years of being in that school was taught by a Hawaiian woman that was all through the ancient culture traditions. And those first 2 years, you were not allowed to ask a question. You were to watch the moves and then do it in your own body. And so for 2 years, I realized I'm an immersive type of learner, right? But it was 3 times a week in her school, being there and absorbing other than just cognitively, right? And getting it through my body. And I was young, right? I started when I was 17, and it was those formative adult years where the value of really learning something that way, not coming in and going, I have to understand it, but to go, what am I really seeing and feeling? And how do I bring that and move that in my own body with that expression? So the way I supported myself was teaching scuba diving. And why I loved teaching scuba diving, not just because it's in the ocean and the adventure of it, but this is how weird I am. So this is why I'm sharing this, so you'll understand. But for me, it was such a joy to have, it was tourists that I mostly taught, and they would come over, and of course they're used to the way they are, who they are, and how they are in the world, and then they're in paradise, right? And now they're learning to use the equipment so they can dive. And once they got into this environment under the water where it was no longer their words they could use, they had to come into this other part of themselves to truly relate. That would just satisfy my heart so much. So this is why I loved teaching scuba diving. So in my 10 years of living there in Hawaii, I also became an ardent meditator, and I was actually very disciplined, in a very disciplined path that had me studying the ancient scriptures, which really gave me this grounded understanding. I mean, there's the ancient Hawaiian traditions that understood their spirituality in their practicality, and the ancient traditions explained, and this is from the East, but it explained, you know, energy bodies and super consciousness, and I actually studied that. So there was this cognition. So here I am. It's after it was about in my end of my 5th year of teaching scuba diving, and I'm realizing that, you know, I'm still very young, but this is not a career that I'm going to want to sustain. And my brother, my brother who's 8 years older than I am, calls me up from Santa Cruz, California, and he says, "Sister, I just took this 3-day training. I don't even know what to tell you it is. I don't know how to tell you what it is, but the guy is right there. He's right there. You've got to go meet him." And he said, "All I can tell you is that it's like, I just feel like I'm moving all the time with this love pouring through me." And I'm like, "Okay, that's good enough for me. Yeah, what's his name? Where do I go?" And it turned out that Dr. Trager was scheduled to give a demo in the next couple of weeks. So I show up at this official demo, and at the time he's probably about 73 years old. And it's a large, big boned man that's there as the client, who's scheduled for knee surgery. And he got on the table and he could see he's in a lot of pain. So I'm watching this 73-year-old kind of leprechaunish man kind of dance around the table, and I'm in the feeling. There's this movement, there's this wave of movement between what's happening with the client on the table and with this dance that Dr. Trager's doing. And I'm watching this, and I'm watching the person on the table, you know, just move out of where he started from, and more relax and open. And I think to myself, hey, that's what I like seeing in my scuba diving clients, but he doesn't need an ocean to make that happen. This is a little more convenient. And then the session ends, and here's a 73-year-old man, and he's like lit up. I mean, he's glowing. He looks like a 5-year-old, right? He's just like, and he's walking around with a guy, and the guy's walking with no pain at all, completely no issue in the knee. And then Dr. Trager looks at him with this glowing radiance and says, "I just learned from you." And that was it for me. I thought, okay, he's been doing this for over 50 years. He's still learning, and he gets this excited about it. I was like, I think I was just ready. And so I had that great fortune of getting to receive a few sessions from him there in Hawaii, taking my beginning training there. So it gave me that opportunity to, you know, to do my 30 bodies in 30 days in a community that was of meditators, and where this spiritual path really wasn't about bringing in the body, right? It's like, so I'm you know, integrating this. And it turns out that if I want to continue and actually do this, I have to go to California to get certified, to go through the whole credentialing. And it happens to be in the area where my parents still live. And so, okay, I'll move back to California, do that, and then come back to Hawaii. I moved back with that intention. I'm in the middle of getting the credentialing, and Dr. Trager and Emily decide that it's too much for them to go back and forth Hawaii, California, and decide to move to California. And so I think, well, then I'm going to stay. And so what I did is pretty much, I was kind of in a mission, and this is what my mission was. I felt that life was having me come back to the Bay Area to bring the aloha spirit to people in California. And in those 10 years that I'd been gone in the Bay Area, it went from the Valley of Heart's Delight, a valley of orchards, to Silicon Valley. And so now there are a lot of people that, from what I'm seeing, really need to know about how to have aloha spirit in them. As I started reflecting on this, even in college, in my physics class, I got excited about quantum physics and started my own self-study with that, right? So when I'm watching how the client's changing on the table, and Milton saying it's the unconscious mind, I'm actually understanding because of there's a familiarity with realizing that it's not only what we're seeing, there's so much more that's going on, and I could relate to it. And it was an association. It actually kind of was like a linear relating. It wasn't, it was very grounded in my body. When you watch miracle after miracle, and that truly is what you would watch when Milton had someone on the table. And what I mean by that is those 3-day trainings, when Milton came into the room, what I saw was everybody there felt the permission to let go of anything they were used to holding in their body or even in their minds of how they were, the image of how they were being seen, and they could become really resting in this core of their true essence. And so for 3 days, we would just, all of us, share this true essence of who we are. And that's where I say, those miracles that you would see, because when we're in that real truth, we know, right? We know. And yeah, we know, I mean, yeah. And when Milton would say, and he always did, every beginning of the class, every beginning of the session, be in this vast ocean of pleasantness. And literally, in Hawaii, you were in that vast ocean of pleasantness. The air itself was the aromatic, perfect temperature, moisture that you just felt supported by. And when he would say that, it was this sense of, we all can have the full support of paradise.
Yeah, I'm curious because you were so young. It's a very formative period for you, and it has, you know, so much impact on your life. How can you say a little bit about how that unfolded in your maturation? You know, how, because it's a wonderful, wonderful strength and awareness to have so young.
Mm-hmm. I agree. I'm really grateful that I got to have the trust in that awareness when I was young, and I guess that's why I brought in my older brother, because I really see that I got encouragement along the way to be questioning outside of just what was being presented to me, to see what I could really know was true for me. And so I would say that's the biggest thing, Elizabeth, in what Trager gave me. So there's about 3 different examples that come to mind. So I'm just trying to. So as I was saying, this vast ocean of pleasantness that is always here, it's this internal way of accessing, knowing it's always there, that just got so supported, right? It was, of course, acknowledged in the trainings, but honestly, you know, for me, I had many times of simply being with Milton outside of the classroom. And when we were together, we didn't talk. We would sit there and be in this trusting of what this is. And it was just this, like we would amplify it in each other. And so we just enjoyed it, right? So what that did in these formative years, going into, you know, coming back to California, there was that whole culture shock, you know, that there's a lot of assimilation. And at the same time, there was this trusting of what I knew from inside, that I didn't have to always be getting it from the outside. And as I started seeing clients and I started understanding how to talk about it, I realized that for me, it's about, there is this ability, and Milton he talked about how the body always will go to its optimal functioning, that it's always designed to go to optimal functioning. And it's just us finding the ways to help it do that, but that it's always designed to do that. So for me, we do have this inner healer. We have an inner healer that will always, always be going in the direction of our optimal functioning, always. So I would help my clients start to feel that in them. And as what is occurring to me is this great example that happened in my own body. This is, I guess I was close to 50 years old. So, I'm living this way, I'm trusting this way, I'm not having reasons to be in the medical model. I have a doctor, but I have health, you know, I mean, and one night I get wakened up around midnight in extreme pain, and the lymph glands in my groin were like the size of tangerines, right? And it was so painful, and I'm like, okay, I don't think essential oils are going to deal with so my mother was a nurse and had trained me, you know, call the advice nurse. So I called the advice nurse, and this nurse had me so freaked out by the end of the call. I was crying, you know, and so I wake up my husband and I go to the emergency room, and they can't figure out what it is. They give me morphine and antibiotics and send me home. And my regular doctor calls me the next morning, and she says, "How are you feeling?" And because I'm so accustomed to this inner healer that will always bring me, I had that confidence. There's a confidence with that, right? And I said, well, you know, I'm not that great, you know, but I'm sure within a couple of days this will all normalize, and, you know, I'll be fine. And she said, okay, but if anything occurs at all, just give me a call. So the days go by, and the lymph glands are not going down like I expect. And it was a Thursday afternoon, so it's like 4 days out, and I feel a slight tenderness, not pain, but just a slight little in my abdomen, right? I mean, literally, it was not almost unnoticeable, but because of living in a Trager body for all those years, I knew that that hadn't been there before. And so Friday morning, I called the doctor, and I just said, you know, it's not a big deal. It's not painful, but you said to call, so I am. And she said, yeah, come in Monday morning. So I come in Monday morning, and she puts me through every diagnostic test possible. Calls me the next day and says, well, Fawn, so the CT scan does show that you have a cyst on your appendix. So the surgeon is going to call you to go have a consult. And still, I, who's so accustomed to knowing my healer will always take me to optimal functioning, says, okay, you know, and there's a day between when she called and when I'm going to the surgeon for the consult. And in that day, I have my 4 clients that day. And I remember telling all of them, you know, because there's kind of a story, you know, a cyst on an appendix. And I remember telling them all that I'm going to thank the surgeon for the diagnostic, but I can deal with detoxing a cyst off of my appendix. Because, you know, to me, a cyst is like, you know, okay, we'll just dissolve it. Anyway, go in with a surgeon, and she comes in. I immediately liked her, but she's really got this different kind of look on her face. And she's telling me, Fawn, I've never met a patient before their cyst burst. And I'm like, what? What are you talking about? She said, well, has nobody shown you? And I said, no. And so she brings up, which of course I love, on the computer, my insides, right? How you know, I got to see my fallopian tubes, all that great stuff. And we get to my appendix, and the appendix, you know, is like the size of my first joint of my little finger. And there's this cyst on it that's like 8 times bigger. It's not a cyst, it's another tangerine. And she said, that's what we call a benign cyst. It's not cancerous. It's a mucus cyst that usually nobody ever feels they have them. Nobody usually even feels when they burst inside. But what they do is they burst inside of your pelvic cavity, and all those little mucus cells hook on to all the internal organs and start growing these tangerines, these mucus cysts. And she said, nobody dies actually of a mucus cyst, but the longest lifespan is 7 years because you have to have continual surgeries to be removing these mucuses. It's the only way they know how to get rid of them. And so, you know, it's a great story about what I believe, this is what Trager has given me, is that I had that level of sensitivity and of trusting and of not going into fear, but being wise and getting to the source. And, you know, I was able, she went in, did the surgery, and, you know, they put a balloon around it so no cells can get loose. And, you know, she took it out. And then for the next 3 years, I went every year. Was there anything more? And they're totally clear. So, and she was so ecstatic when she came in after the surgery because it went so cleanly, right? There was nothing in there that was obstructing anything she needed to do. And so it was like this clean surgery. So that would be one example. I will say that it's always easier for me to talk about Milton, right, than about myself. So I want to share a little bit about him right now, and then I'll come back.
Yeah.
Because this, to me, this is really important, that this really is understood in what the Trager approach is, where it's coming from. Every moment that I ever experienced with Milton, I always saw that he was completely surrendered and devoted to giving to others what he had. He wanted us to get it so much. He would give everything he could for you to have your own experience of what could be free, what could be lighter, what is you, right? What is your aligned optimal functioning? From this soul level, I honestly believe he was this soul that had this mission to to bring this to others as much as he could. So, you know, I recall this class it was a large class, and we were all either just tutors or instructors. And there's about 30 of us. So the opening circle was a big opening circle, but everybody there, he knew there was a history with, and he took the time with each person. What do you need from me while we're together in these 3 days? And, you know, he would, you know, have you describe, you know, we would try to stay in our bodies to describe what we needed, you know, because that's the language. But the whole time I would just see him literally this desire from the ground up and the heavens above, just wanting to channel it into each person to see that what kind of thinking was getting in the way, and let that go so that they could have this absolute aligned freedom in their bodies. And my point with this is, it was always about giving. Milton just gave it. He was giving it, and he was so sincere and so devoted. And so this, my story is that my spiritual path that I was on, it was, it had its own teachers and establishment. And of course, I had been giving Trager sessions to the hierarchy in the organization. And I happened to be I was known, I was well known in the organization. And the leader had come into town. She was visiting, and she wanted to invite Milton and Emily to come as her guest for the afternoon and really honor them. And so my husband and I brought them, and the whole time, for me, okay, so first of all, this is a very structured path, and the teacher was very gracious in making sure they felt really honored, and they were given gifts, and they were made sure they were comfortable, and then there was this dialogue between them. And of course, Milton is like, what words is he get? He's connecting and he's in the feeling, but it's like he doesn't talk about his work, and he's so finally she just starts pointing to her people around her, around her, who gets to receive network from Milton. And they lay down there right there, and Milton, does his thing. And in those days, it was still the really big rock and rolling, and and he probably worked on 10 people, right, during this exchange. And then there was this beautiful lunch and a tour, and all the people there were really gracious in honoring him and Emily. And they kept calling him a healer, this gifted healer. And as you know, in Trager, Milton really he just really did not want to be in any kind of hierarchy with a title. But for me, because this was a community that I knew very well, right? And I knew these people that he worked on, and I saw what happened to them. I had to accept he's a healer. He's a gifted healer. And because I'm doing this work, I'm that too. And it was this evolution of, knowing and trusting our own inner healer. It's okay if we call ourselves healers, if that's what helps others to get there. And that was it was great for me to kind of move through that. And I just remember, we took Milton and Emily back home, and then I went back to the center, and there was this big evening program, and she talked about her meeting, the time with Milton, and how she described him was this radiant man who was totally surrendered to God, totally surrendered to what came through him to help others. So that was I have to say, one of my highlight days in life, just because, both teachers.
And you were with him during the very end of his life.
Yeah, I was.
Yeah. Is there anything about your experience knowing him then that you could share?
Yeah, okay. So what I'd like to share is when he had his stroke, and I term it as so here's what happened. Here's my experience. So you know, you heard of the days of the wild movement. And there were times, I mean, Milton would have a body on the table, you know, and some of the legs on the table would lift, you know, because they were, you know, the amplitude was so big, you know, I mean, it was beautiful, and it, you know, and it served its own purpose. And then, you know, Milton was in his mid 80s and he had a stroke. And I remember because he had the stroke on the weekend, and it was that upcoming Friday that there was a training scheduled for him to lead. And so there wasn't enough time in those days in the Trager Institute to cancel the training, right? Because people fly from all over. So Bill Scholl and I and Sheila Merle were asked to come in Milton's place. And so I remember that, you know, how we brought in the feeling of Milton for those 3 days. And then it was the following week. He was in the hospital for a couple of weeks. And then he came home, and I flew down to see him. And he opens the door. He had not seen anyone yet. And he opens the door really slowly. I mean, everything's like all of a sudden really slowed down, right? And you have to understand this about Milton. He was very dedicated and had this earnestness, but at the same time, he had a little impishness in him. He had this little twinkle in his eye, and he'd get this little, you know, he'd be like, and that was still there completely. It was like he opened the door, it was totally slow, but he had all of his twinkle. And so we came in, and I was with 2 other men, which is really smart because Emily enjoyed getting the attention from the men. And so they you know, entertained Emily. And Milton just wanted to get alone with me. And so we did. We were sitting there, and he, you know, he brings out his arm where the side where he had the stroke. And he's showing me what he's doing to completely bring back the paralysis from the stroke, right? He's just doing this on himself. That's what he was doing in the hospital. He started working on himself. So now he wanted me to do that. So I come in, and of course, you know, I'm totally intimidated, but you know, I'm going to try. And so I come in and I start doing what I believed I just was seeing him do, and he'd go, softer, and the lighter there. There, you got it. There. And we just spent, it was probably like an hour of him completely, I want to say retraining in a way of what to do. And that was the beginning of how the work changed and what it looked like. So it was from there that, you know, the slowing down, and, you know, I mean, he did recover for a while, but you know, there were those, you know, the whole change started happening. So at the very end, so in my life, my mother, I turned 40, and 10 days later, my mother died of a brain aneurysm. So it was very shocking, and you know, and Now, this was 2 months later that I get the call that, you know, Milton's in the hospital and this is it. So I went down and I spent 3 days there. My husband made me promise that I had a return ticket after 3 days, because he knew me, that if they needed me there, I would stay longer. And he also knew that I wasn't at a place where I could, you know, I still was recuperating from that loss. But in those 3 days, I helped Emily move through her own denial of that Milton wasn't coming home. And this was one of the things I wanted to bring back. Milton was devoted to Emily. Emily had lupus. And so stress would turn her into this, it was just horrible what would happen when she would have a flare-up in her lupus. So Milton was devoted, ever since I knew them, to doing everything he could to always keep Emily at a place where she wouldn't have flare-ups. And that they were so bonded with that. It was this such a dear, sweet, kind, loving symbiosis, so here's Milton in the hospital, and Emily's with who Emily is, she can't really grasp it. So I would spend the daytime in the hospital with Milton, and I'm chuckling because what I would do is he was going in and out of consciousness, right? In and out. And I could see, because this was what I'd been learning from being with people who passed that I love, that his connection with Emily was still keeping him in the body. I could see that he was ready to go. And then it would be this emotional attachment, would be the word I would use, that Emily needed him, and it would like bring him back in. So I would work on his feet. I would do Trager on his feet, and I would sing the song, right? Our traditional Trager song, right? From you I receive, to you I give, together we share, from this we live. And I would sing it over and over here in the hospital. And he's in this reverie, and he's, and then, and then he'd come back in, and anyway, what can I say? That was our relationship. And then in the evening, I would go and stay with Emily and help her work through that he really wasn't coming home. And I'm grateful that I could do that. So third evening, I have my plane ticket. I have to leave. Milton has not made his final transition, but that was the agreement I made with my husband. So I go to the John Wayne Airport, and the sun is setting. And I get told when I'm at the gate that the flight is delayed for an hour. So I have nothing to do but to sit there and look at the sun setting. And as I'm sitting there looking at the sun setting, all of a sudden I can completely see on the other side of the sun is my mother, joyously, ecstatically helping Milton over the transition. She's like this, they're doing this whole, I can't truly describe it other than, she was so ecstatic that she was on that side, that she could help him fully come into it, because she knew about the love between Milton and I. And that night he made his transition. So that's my story of it. I'd like to bring it back to the work, and you know, yeah, there's a couple of things I want to. First of all, I'd like to address what a lot of us have, tried or find our way with, in that Milton so wholeheartedly believed his approach did everything. He didn't understand why anybody needed to go study anything else, because for him it really did. And I because I had this personal knowing with him, I understood why he felt that way. But what he wasn't taking into accord was that he was a trained medical doctor, that he had studied Chinese medicine inside and out, living in Hawaii. He had done this psychological internship, so he, had his, basis of psychology besides being with people all his life. And he'd been a physical therapist for many years. So there was knowledge base and skill set that were tools in his tool belt. I honestly believe that what he did just came, it was a pure download into him that just came through him. But when needed, he had this toolkit, and he didn't understand that, those of us showing up, yeah, I taught hatha yoga, but so anyway, I understood his side of it, and I also honored my own. And I remember, and again, I'm just so grateful being in the Bay Area, where there was so much innovation that was available. And one of the things that became available was studying with this Rolf student of Ida Rolf's, cranial sacral work. He was teaching cranial sacral work, but he'd been a long time Rolfer. And when I went to lunch with him on the first day of the class, and we were talking about our teachers, Trager and Ida Rolf, who believed their method was the method. And he said, that he had a talk with Ida, and because he was so drawn to the cranial sacral work. And what Ida Rolf said to him is, you do one modality for 5 years, nothing else. You stay and you incorporate that modality. And then after 5 years, if you want to study something else, you go and study it so that you become even better at that modality that you've studied for 5 years. And that's the approach that I just thought that made so much sense, right? So I jokingly say I have a PhD in all of the other trainings I have taken over the years that I'm so grateful for. And they're wonderful tools in my toolkit. And I'm so grateful that I have understandings of how people learn, so I can communicate and just many different things. But I call myself a Trager practitioner. I mean, I have a number of certifications, but I don't list them, because that for me, it's always been about integrating it and having it available. But I'm always starting at this foundation of the Trager principles, because they are so effective.
I think that when one allows oneself to take all that you learned and be willing to learn, go look for things that interest you and attract you, and then integrate them, and, within yourself, that's honoring, all of them. And if there's one modality that particularly speaks to you, that feels most comfortable, that the others can work within. I mean, that's honoring Trager, you know, that's honoring Milton, because you are following your own path, you're following your own ease, you're you know, basically the Trager principles are coming into expression in your own work. You know, you can't be Trager. You can't be anyone but yourself. I can't be.
Right.
So yeah, I think you know, that wanting to and allow being aware that you have this ability to be your best.
Yeah.
That's part of it. So.
Be our best with the support of the vast ocean of pleasantness at our back.